Dr. Sue Decotiis is a medical internist.
On today's show, we are with Dr. Sue Decotiis.
Here to weigh in, Dr. Sue Decotiis.
Joining me now is Dr. Sue Decotiis. Sue, you're a weight management specialist.
In my practice, we really customize this approach for each patient, depending on their age, depending on their medical history, their genetic history, their family history. And there are so many things that we can give them that can help get their metabolism going.
Dr. Sue Decotiis, a medical weight loss doctor who has treated hundreds of lap band patients. All right, for my benefit and our audience, tell us what this surgery is and how it works.
Well, the lap band procedure is only one of 3 very popular weight loss surgeries. But with the lap band, which is what Governor Christie had, they put a band around the top of your stomach. But the problem with the lap band, Jerry, has been that so many people that are not morbidly obese are getting this procedure done as a quick fix. And those people in particular do not do well. In my practice, I've seen these people lose maybe 20, 30 pounds and gain it back.
Oh, that's so sad. Thank you so much for being on the show today. Really appreciate it.
Thank you so much.
It's called Belvique. The question is, how well does it work? Well, joining me now is Dr. Sue Decotiis. Sue, you're a weight management specialist. That's what you do, right? Are you excited about this drug?
I'm totally excited about it, Dr. Steve. But this works directly on the brain, and it really turns off that hunger impulse in a part of the brain called the hypothalamus. Studies showed that it was very well tolerated, and it had a very low dropout rate. So most
important.
patients stayed on it, unlike a lot of other drugs that have come out.
All right, such great information, Dr. Sue Decotiis. Thanks so much for coming in.
Jolie revealing today she underwent a preventative double mastectomy. With more on this, Dr. Sue Decotiis. Dr. Sue, welcome back to the show. It's good to see you.
Nice to see you, Jerry.
When would this be the right decision for someone?
If you have a strong family history of breast cancer and perhaps other cancers like ovarian, pancreatic. Now realize that preventive mastectomy is only one of the things you need to do. The first thing that you would need to do is just very cautious screening. You might want to get yearly mammograms, sonograms, perhaps MRIs, and you would work with your physician and your breast specialist to help you determine what that might be. And making lifestyle changes is extremely important.
Dr. Sue, thanks for coming on. It's an amazing story, and she is so brave to have had this.
Very brave, and I think she made a very good decision, considering that her risk was close to 90%.
Sue, thank you.
The American Medical Association has just classified obesity as a disease. Here to tell us what it means and how much more we may have to pay is Dr. Sue Decotiis. She is a medical weight loss specialist. Doctor, thank you so much for coming on the show.
So we really have to focus on treating obesity, preventing it, so that people don't get all these complications. They're working on science and different types of things that affect the fat cells themselves, the adipocytes, and those are really the causal agents in obesity, because if you're over 20% of your ideal weight, your fat cells in your abdomen take on their own life, and they become real endocrine organs that do a lot of bad things to your body.
Doctor, thank you so much for coming on the show. Interesting stuff.
Thank you.
We appreciate it.